So my name is Jill Thomson. I work for Saskatchewan Polytechnic. I work in the nursing division, specifically the psychiatric nursing. For anybody that is interested in the mental health profession, psych nursing is actually a really great hands-on program to take. So what I can tell you from my personal experience is that the roles can be very similar between an RN and an RPN. And an RPN, of course, being a registered psychiatric nurse, and an RN being a registered nurse. It really depends on where you work, and it's really vast opportunities. You can work with children with disabilities at a place such as Cosmo. A lot of our graduates work at Wascana Rehabilitation Center. So whether you're helping clients rehabilitate after an accident or an injury or some kind of disease process, we can work with ventilators, we can work with tracheostomies, suction patients. We can also work in community mental health. You can work, there's so many vast areas. We can work in the school systems. We can work in emergency under the premise of acute mental health emergent situations. So we do have a couple of psych nurses who work in our local emergency room who see clients who are in the acute stages of mental health crisis. There are so many different opportunities for psychiatric nurses. You can also be an educator. We have a full faculty of educators that educate psych nursing students. We have psych nurses who do research. We have psych nurses who are in administration, formal management, supervisory, and leadership roles. So there really is an endless opportunity for psych nurses. If, however, your goal is to work strictly with intensive care, traumatic type of physical injuries, like working in the ICU or working in cardiac care, then the psych nursing program is probably not the best avenue for you, because we do not currently practice in any of those areas. We focus mostly on either long-term care or with people with physical disabilities, acute mental health crises, but we absolutely have diversified a lot, and we work in forensics with incarcerated individuals as well. I also work at the Regina Correctional Center, so I know firsthand that we hire both RPNs and RNs at that facility. So there are many opportunities for psych nurses in the healthcare field. So we have a 40 student intake currently, and that's in Regina. And we have 16 with Northwest College from North Battleford, which is a school that purchases our program, and they use our curriculum, and then they have 16 graduates from Northwest College as well, assuming that all 16, or that's their intake. Hopefully all will be successful. So as far as the program goes, it's 2.5 years for the advanced diploma. And we just created the curriculum. Actually, this was our first run through. We did some substantial changes to the program, and we currently have some changes that are going to be upcoming as well, just based on the first run through. But essentially the students will have 7 semesters. So the first intake is the fall. It is a cohort system, so they do come in as a cohort of 40, and they will take the courses that are ascribed in that semester, which can be found on our course page at Sask Polytech. And they range from biology, some introduction to psychiatric nursing courses. There's a clinical in the first semester. We have 75 hours of clinical in our very first semester to get students introduced to actually working with clients. We have foundations of nursing, so they will learn all their foundational work, some lab values, the human body sort of from head to toe, spirituality, that type of thing in terms of caring for clients, looking at them culturally, looking at them holistically, as well as their physiological needs. We also have a very intense medical surgical nursing skills course, and that runs over semesters 1 and 2. So that's right, everything from learning how to wash your hands correctly, learning how to make hospital beds, learning how to do dressings, catheters, trach care, suctioning, bowel care, urinary elimination, right up to blood, administering blood products, working with PICC lines, working with central lines, and IV administration. So it's right across the span, and that does take 2 semesters to get through all those skills. So we have what's called Medical Surgical Nursing Skills 1 and Medical Surgical Nursing Skills 2. So the more basic skills are in semester 1, and as we get more intermediate and advanced skills, that's in semester 2. We also teach pharmacology in semester 2, so they will learn general pharmacology. It's a 4-credit course. Most of our courses are 3 credits, but the pharmacology is a 4-credit course, and it's where they're going to learn all about medication administration, medication safety, absorption, metabolism, how the body uses the medications and excretes them. So it's a very intense course, but they also do learn to mix medications and do drug dose calculations and learn how to safely administer meds right from pediatrics all the way to geriatrics. What else can I tell you about it? So we do have another clinical in semester 3, which is in the spring, and that's a 150-hour clinical course. And that's where students will learn to implement all those wonderful foundational skills and medical surgical skills and communication skills that they've learned in the prior semester. So our admission requirements are also on the website, so hopefully we can display that as well. But it is first qualified, first admit. So students are encouraged right when they're done high school or even before they graduate to go ahead and apply. And once you qualify with all of your basic sciences, your basic grade 12 core classes, then you will be able to be qualified to the psych nursing program. So all of the requirements are on our website. So we will highlight those for you as well, so you can take a look and navigate through them. But they're essentially your core courses. You'll need some sciences and some math, and then you will be first qualified, first admit. So get your applications in early. If you're a current student in high school, really pay attention to your math classes, because our drug dose calculation examination, it is essential that students understand fractions, decimals. We will be mixing medications, so you need to understand your measurements, your ounces, your mils. So it's really a good idea to pay good attention in your math classes, because the drug dose classes, while most students are successful, we have a high success rate. The students that do well in math, or did have a fairly decent understanding of math, do tend to find it a lot easier. And also we do have an English class that is in our program. So we have English 101. So it is a good idea if you have a good understanding, obviously, of the English language and are proficient in English. We also have a lot of science-based classes, learning your anatomy and physiology and pathophysiology. So if you have a good understanding of biology and your sciences, that also usually helps students to be successful. So one of the things that we do encourage anybody that's going to take the Advanced Psychiatric Nursing Diploma program is that there are some courses that they can actually take through continuing arts and sciences. It's a different program in our school, but they can actually take both biology, so that's biology 102 or 103, and also English 101, because that's a part of our curriculum as well, and Sociology 171. So those courses can actually be taken prior to getting into our program, which will definitely lighten the students' load once they're in the program if they don't have to have such a heavy workload. Our students do find biology can be a little bit on the heavier side. So if science isn't your strong point, that might be a good opportunity to take that while you're waiting to get in, because we do have, it's first qualified, first admit to our program, but we do tend to have a waiting list. So those are just some suggestions if students are waiting. So a lot of questions that we do get if students come into the psychiatric nursing program, perhaps they either took a degree elsewhere from another university, maybe they have a psychology degree, or maybe they have a degree in some sciences, or they have taken a few classes at university. So what you would do is you would basically just apply to the school, and we will supply your transcripts and the course outline and the blueprint of the course that you took. And we also can get that from the university as well if you're unable to do so. And then we do a cross comparison to see if you met approximately 75 to 80% of the course that you took matches the course that you need to take with us. So there is definitely a way to get transfer credit, but that is something that you need to apply through. You apply to registration services, and then they will contact us, and then we will analyze and do a comparison. Likewise, we also get asked, what about when I finish the psych nursing advanced diploma program? Can I use this to perhaps get into the practical nursing program or the RN program? So the answer to that is absolutely. Some of our courses, not all, but some of our courses are transferable to other universities. So again, what that would require is that you would need to contact the registration services at the university or college where you hope to get transfer credit from them for our classes. Then what you would do is you would contact us. We would provide either to you or the college or university where you want to get credit with our course outline and blueprint of our course, as well as your transcripts. And you will send those to the college where you want to get transfer credit. And then they will determine how much of our course relates to the course you want to get credit for, and they will determine if you get credit for that course. So we do have biology courses, we do have an English course, so hopefully the university or college that you apply to will accept our transfer credit. If you do intend to apply at another Sask Polytech program, for example, if you wanted to be a practical nurse and took it from Sask Polytech, the chance that they would give you transfer credit is fairly high, because this is their program and they probably use a lot of the similar courses, like the sociology course, the English course, the biology course. So it just depends on where you apply and whether or not they accept our courses as a transfer credit. The other thing I wanted to mention with regards to our program is, so after they take the two clinicals, one is the first semester, 75 hours in year one, first semester, and then again in semester 3 in year one, we have 150-hour intense clinical component. So you can expect that all of May and the first week in June, you will be designating about approximately 40 hours a week to a clinical experience. So it's basically a block of the month of May and part of June. In year 2, now year 1 is out of Regina. We are planning to take in a 16-seat cohort in Saskatoon. So if students are able to access our year 1 out of Saskatoon, we are figuring out how to make that available, and whether those classes will be via Zoom or online or in person. We have to work out all those details, but those seats should be opening up this fall. So that's fall of 2022. Currently, They're in year two. We have clinical opportunities in every semester. So we have another clinical opportunity, 165 hours in semester 4. We have another 165-hour clinical in semester 5, and another 165 clinical opportunity in semester 6. Now in semester 7, which is the very final preceptive experience, that clinical, there's no classes alongside that, so that's quite nice. And there's 375 clinical hours in your very last preceptive experience. So that actually takes place from September right up until December. It's the last clinical where all the courses that students learned throughout the 2.5-year program get put into play, and then they can demonstrate to their preceptor and their clinical agency all the great skills they know. And the objective is that hopefully they'll be employed at that last agency. Because when you have a 375-hour clinical over a block of 4 months, that agency has invested a lot of time in the student, and the student has invested a lot of time in the agency. So that getting hired at that last clinical preceptored agency is very high. We have a really good success rate at getting students employed. So we really like the way the program is set up that way, so that hopefully we have a high employment success rate following the program. One of the points at Sask Polytech, as far as leadership goes in the organization as a whole, we really pride ourselves on the fact that we are an applied science program, and our programs are really hands-on. We really have a lot of clinical opportunities in each of our semesters. So a lot of students have a very, very high success rate of getting employment after they graduate. I don't have the exact statistics available, but our students from the psych nursing program are somewhere in the 90 to almost 100% employable if they pass the registration exam. So we do try to set our students up for success. They do have to write a registration regulatory Canadian exam. Once they pass that exam, then they can work as a full-fledged psychiatric nurse once they're registered with the regulators. But our success rate is extremely high. I think it's in the 90% of getting employment following your success of the program. So one of the things that are unique about the Psychiatric Nursing Diploma program, Advanced Diploma program, for Sask Polytech, is that year 2 is actually off-site. So we have different opportunities for a clinical group, usually approximately 8 students, go to different areas. So currently, and this is subject to change, but currently we use Moose Jaw, Swift Current, Prince Albert, North Battleford, and Saskatoon. So those are agencies. So students in year 2 will not be in Regina. So if you do get accepted into the psychiatric nursing program, it is essential that you understand that your year 2 will be completely off of the Regina campus, and your clinical opportunities will be in those sites that I just mentioned. So another question we get is, am I suited for psychiatric nursing? Do I have the qualities and attributes it takes to be a registered psychiatric nurse? So I can give you a brief indication of what some of the skills and attributes we look for a successful person that enters into our profession. So you definitely need to have empathy. Empathy is extremely important because you're going to connect with clients probably at a very challenging point in their life, often when they struggle with either physical or mental health challenges. So being empathetic, kind, and patient are really important attributes to have so that you can help clients along when they're having challenges in their life. It's also really important to be able to have critical thinking skills. We do teach critical thinking skills in our program, but having those essential skills where you have good clinical judgment, good decision making, you really have a sense of right and wrong, you have a good moral compass, good ethical values. They're really important because sometimes you have to make decisions and it's not clear cut, it's not black and white. It's not necessarily every point you're going to come across has a textbook answer. So you have to be able to think on the spot, have those good clinical decision-making skills. We also really encourage people to be proficient in the English language. And that is because our clients, sometimes they're hard of hearing, sometimes they may be they might have dementia. So having somebody who can really speak clearly and articulately to the clients that they serve is really helpful. It helps our clients who do have those types of challenges better be able to hear their care provider. Other assets that are really helpful is to have really good study skills. We have heard from students that this is a very rigorous program, and we don't deny that. It is very, very filled with classes in each semester. So if you don't have good study habits or you don't take studying seriously, you might find passing this program a bit of a challenge. So I do encourage you to perhaps visit Learning Services. If you've had any issues with learning, you might want to see if you can get tested for accommodations that you might need. But definitely you need to designate 2.5 years of your life to the program because it is very intense and they are long days. So I definitely encourage those good study skills. Other aspects of the attributes that would be really important, I think, is just good leadership skills. We do also teach leadership skills in the program, but if students come in with that understanding that we expect right from day one students to be very professional, have great communication skills, really, really good listening skills and active listening skills, and that communication piece as well as that leadership piece, that is really important because when you go through the program, we are going to be working with a lot of stakeholders. We're going to be in numerous clinical agencies as guests in their facility. So we really do look to students to have those professional leadership and communication skills very early because our first clinical is in year one, semester one. So we do value those abilities of our students immensely. So we do have a lot of services available to students once they actually are accepted to our program. We have learning services available. So students who want extra help or struggle with their perhaps formulation of papers or maybe their drug dose calc questions, they can absolutely access learning services. We do have an opportunity for students to be analyzed and determine if they need special accommodation. So if they need extra time, if they need a reader, we don't want to have any barriers between student success. So perhaps if someone's dyslexic, we can get them in touch with our learning services and they can figure out ways to be successful in our program. We also have library services. So librarians are available to help students with research, accessing evidence-based knowledge, learning APA. That's the American Psychological Association publication manual. That's the format writing style that we use at Sask Polytech. So we have librarians that are proficient in that if students struggle with being able to formulate papers according to the APA manual style. We also have counseling services available. So once you're accepted into the program, you can absolutely access counseling. You can definitely apply for student bursaries. Sometimes they have different types of funding available. So that's something that you can look into with your student services representatives. We also have Indigenous services. So if there are students who are Indigenous and want extra support, we have a whole department that is available for students, if that's something that they feel would be of value to them. We have a cafeteria on site, so our first year students also, they can have a cafeteria that's in the main building. Most of our site nursing courses are taught in the Parkway building next door, but the location is very close. It's just a 5-minute walk across a pathway, and then there's a beautiful big cafeteria. And some of their courses like English and biology, they're usually taught in the main building. For any Regina student that's on site, we actually in our main building at Saskatchewan Polytechnic currently do have a physical fitness facility, so a gym that they can have access to. So we can't say for sure if that's going to be an ongoing thing, but at the time being right now, it is accessible, and it's accessible to both staff and students. We also have a very big focus on wellness. So there's a huge portion of our website at Sask Polytech that students can click on, and there's all types of information about wellness, mental health, things online that will help them, that they can access to connect with other people. So we pride ourselves on that being a main focus at Sask Polytech for the broader students. So on our website, as you can see, there's the Advanced Psychiatric Nursing Program. So all you would have to do is type into your Google search bar Psychiatric Nursing Advanced Diploma or Saskatchewan Polytechnic. And on the right-hand side, you can go and find all your information that you need. So for example, I'm going to click on courses here, and this tells you the whole semester. So this is subject to change because we did have the first run through of our Sask Polytech Psych Nursing Advanced Diploma. So we are going to do a little bit of revising here, which should be updated in the next couple months. For sure by August, it'll be updated. But you can see how many credits each course is worth. And you can actually click on the drop-down menu and see the descriptions of all the courses. So if you're not sure if this is the course for you, you just literally have to drop down and see what's available. And it has it right through to our 7 semesters. So of course, I'm an advocate of the psychiatric nursing program. I am the curriculum coordinator, and I have been teaching here at Sask Polytech since 2008. What I can say about the program is it's really a really rigorous, intense program with a lot of opportunities for great learning. You learn about your own health through learning about how to help other people. So you will learn all about your body, all about the biology of your body, the anatomy, the physiology, how food is digested, excreted, absorbed. We find that people that go through our program, not only will they be able to graduate and help others, but they can actually help themselves because they will learn a lot more about healthy lifestyle changes. Perhaps if you're a smoker, you might have the encouragement to have smoking cessation and quitting smoking because you're learning about all the healthy, important things that you want to do for your body and all the things that are toxic to your body. The program is very reputable. We have a good reputation through the province. We have many stakeholders who we network with. We've got lots of opportunities for students to be placed in numerous different agencies throughout Saskatchewan. And the great unique thing about the psychiatric nursing program is that if you decide that you want to do a practicum in, say, BC or Alberta or Manitoba, anywhere where psychiatric nurses are recognized in Canada, you're absolutely allowed to do a placement there. So we have had students in their senior years. Now, this applies only to your senior practicums, but if for your senior practicum, you want to move out of province and you think that's where you want to work, if you find a placement, an organization, an agency that will accept you, and a psych nursing preceptor to preceptor you, you absolutely can do that. So that's a great opportunity as well. So I think, with how well-respected psychiatric nurses are, and with all of the mental health crisis that we're in, globally, mental health is an area that is finally talked about. People are finally open and willing to talk about mental health concerns and challenges and issues that they have. And I think having psych nurses at the front lines helping people get through their crisis is immensely important. So we really are proud of our program. We're proud of the graduates that we have, and we're proud of the work that we do in the community and within our hospitals and long-term care facilities.